Thank you for joining us for another episode of Health Matters. My name is Marie Carbonara. I'm the health officer at Radnor Township. I'm here today with Dr. Clarke Piatt, and we're going to talk a little bit more about a very concerning topic of vaping. So thank you for joining us. If you want to tell us a little bit about yourself, Dr. Piatt.
My practice is in pulmonary and critical care medicine. I've been a resident of Radnor for about 20 years. In my practice scope, have had some encounters recently with young people with vaping-related lung injury, lung damage, and I felt as a pulmonologist, as a citizen of Radnor, it was my role to step up and speak to what is really an epidemic of concern, both with vaping-related lung injuries and the consequence to our youth in terms of what vaping can mean to them in the long term. So it was something, we've had some index cases recently at our local hospitals that were quite frankly terrifying. And not only as a physician, but as a parent, knowing that our youngsters were at risk for potentially horrific complications from vaping. And I know we have spoken, and we have a lot of advocates here in Radnor that are kind of speaking out of the perils of this, and this is one other venue that we can get out information about what we can do to help our youth.
Okay. So with that, the CDC and the Department of Health have come out with alerts about severe acute pulmonary disease and lung injury related to vaping. So if you could tell us a little bit more about that, the signs and symptoms of the lung injury.
This is unique in that prior to a few months ago, we've had vaping-related issues, but really since August, there's been a spike in terms of issues, not only nationally but locally, where we've had people present with flu-like illnesses. They often stay at home for a few days thinking it may be a cold or some minor viral illness. Parents as well who view their children with this think it's, again, maybe we'll just wait. It's time for school and whatnot. Perhaps this is not a major sickness. But there are also some other symptoms that were popping up with us as well, including nausea and gastrointestinal disturbances. Patients would present to often hospital emergency rooms, and the scenarios that we saw were patients with very low oxygen levels hitting the emergency room door. The national crisis, and this echoes what we've seen in other states, is patients present with profound abnormalities of their X-ray, low oxygen levels, and often are very refractory to our treatments. Normally we would treat for pneumonia, but in these cases patients were not getting better with antibiotics, they're not getting better with steroids. We saw them, instead of getting better, often getting worse over just a few days in a hospital environment, progressing to sometimes needing mechanical supports to breathe. From the front lines of medicine, I've not seen anything like this in my career in terms of the speed in which we've seen an epidemic. We've seen now nationally, as of today, I think there are 9 deaths related to vaping-related lung injury, and there are hundreds of cases that have been reported. We think that there are probably hundreds more that have not been reported, only because I think some have had degrees of vaping-related injury who have not come to hospitals, who've had milder forms of it. We've only seen the worst. But the worst is a terrifying condition, because it's one that we've seen, not only the deaths, but impairment that these young adults will have for the remainder of their life. So it is a unique presentation too.
Okay. So based on what you've seen in your practice and locally, what do you think is the cause of it? Is it the mechanism? Is it the device? Is it what people are putting into the device that's causing this injury?
This is a very complicated topic in terms of what devices are out there. I think the entire e-cigarette industry and vaping is kind of under this giant bubble, but clearly there are different products. I think that the prime concerns are the liquid-based systems that are often with THC related products that are not commercially based, like the state of Pennsylvania through their cannabis programs has very regulated products, but what we've seen is that THC products are often been associated, but not conclusively. The cartridge-based systems that have a fair amount of content are the ones I think that are most involved in the cases that have been presented. Those are the ones that I think carry the most amount of content, the most amount of risk at this point. But the story's not done. I think as the CDC and the state looks into this, we still haven't found that common matrix for what is the cause for the vaping-related lung injuries. I think the more insidious related issue, though, is not necessarily the cases that we see in the hospital, but really the delivery systems involved in the e-cigarettes that we see youngsters use. The delivery systems are prone to have enormous amounts of nicotine and their addictive potential. These devices were sold initially to be smoking substitutes, thought to be safer than cigarettes. But the reality is they're not safe. They're just deemed not as toxic as a cigarette-based traditional product. So for those that use these e-cigarettes as a recreational drug, it's a concern. It's now a gateway to using not only cigarettes down the road, but using nicotine as an addictive substance for which you can't get off of easily. So two different layers, multiple different vectors of delivering vaping products. But I think the immediate concern for the vaping-related lung injuries and the more illicit, non-regulated products, that's I think where the focus is. But again, that vast market of young people, and particularly using nicotine-based delivery systems for recreational use, has exploded. And that's where this second concern is.
Okay. Okay, so I guess with that, with what you're seeing in the hospitals and in your practice, are you or other healthcare professionals, are they obligated to report these cases? I know we're still learning a lot about vaping, and we've learned a ton over the last few months, and I know everybody's gathering information and trying to figure out if it's safe or not. So I guess what you're seeing, are you reporting this, and if you are, who are you reporting it to?
We are obligated morally to report it.
Okay.
And right now the state of Pennsylvania reporting services would be poison control.
Okay.
So poison control is a number that is shared throughout the state. So using that vector to report it, whether you're a family practitioner, an internal medicine specialist, a pediatrician, a parent, a patient, that's the mechanism to report suspected cases. They work in tandem with governmental agencies like the CDC to kind of really narrow it down and put focus. What they're trying to find out in this epidemic, in this forensic analysis, is what the sources are. You know, there have been clusters of bad product that have been in areas like the Midwest. I know there was a large bust that they had a cocktail of these jerry-made products. They were looking for those common sources, so the CDC is really the leader in terms of coordinating that. But poison control is our vector for reporting it. Legally, I don't think we have a position that you have to report. There's some reportable illnesses that we would, but this is not in the league of having to report. But it's clearly for the epidemiologic piece, we should be reporting all these cases of concern.
Okay, so I guess I just want to backtrack just a little bit. So you mentioned some of the symptoms that these patients are coming in with are fairly mild initially.
Yeah.
So what should we, I'm a parent of 4 teens, who are in local schools and, who have these similar symptoms, several times throughout the year. So what am I looking for, or what specifically symptom-wise that would, make me take my kids to the hospital?
I would say that we're all going to experience the adolescent that has cold-like symptoms. They're going to have a cough, congestion, whatnot. I think we're worried about the cases where there is lack of improvement. There is an intensity of the symptoms that are increasing exponentially more than what they've had in previous mild flu bouts. I think if there is a suspicion of vaping in the background, it's another threshold that may alter your call to be sooner. I think family practitioners, pediatricians' offices are now adept at kind of recognizing some of these issues as well. It doesn't hurt to make a call of concern. I think any parent that feels that things are getting worse out of proportion to what they've normally seen, combined with any suspicion of vaping-related behavior, it's frankly hard to address. It's the kind of thing that as a parent, you don't sometimes know it's occurring. But when you do have the suspicion that it's something you need to act on, make the call. It's not going to hurt.
Okay.
You know.
So with that, I know that vaping is seen in kids as young as elementary school, and even and pretty
middle
significantly
school.
in middle school. And I think because we don't know a lot about it yet, and we're learning as we go, what would you say are there long-term effects for our young kids who are starting this now? Are there going to be effects later on?
There are immediate concerns. The immediate effects, I think, there would be behavioral issues related to this. The introduction of nicotine, the introduction of this habit at a young age is the biggest concern. What we don't have is the luxury of knowing 30 years from now what damage is going to occur. And I think the reality is that we're expecting it as clinicians, as scientists. We're expecting a provable point. But it's hard to have that kind of evidence with only 5 years of an epidemic like this. We just don't have the lead time. Asbestos, for example. If you're exposed to asbestos, the down road of that is 40 years down the road. We don't have that luxury, of knowing. And I think what we do know is that as a addictive substance, nicotine, the delivery systems that are involved, we saw these products initially rolled out as ways to stop smoking, as a safer way. But I think we've seen years of smoking drop in terms of the incidence, but now we see this exponential rise in this product, which is deemed to be socially okay. I think we need to have a path to say that vaping and e-cigarettes is not an acceptable alternative. It's just not something we should be introducing as, oh, it's okay. We should be in the same way that tobacco products are, they're not okay. But if they're going to be used, they should be used responsibly and as a tool to perhaps make you stop smoking, as a recognized delivery device, perhaps for medications that you take for chronic illnesses. It makes sense. But for a teenager or a young adult to assume to take vaping as being a normal behavior, it is not a healthy behavior. And I think that's what we need to drive home. So.
And that just leads me into, since you've seen the effects that this can have on our kids and teens, if we were to sit down with our kids today, what can we add to the conversation to help persuade them from either trying it or stopping it altogether?
I think it's an age-old problem, and that you have the conversations about the potential risk, but when you're young, you can't see the risk. You feel that it's not going to be you. I can tell you that the people that I've seen in the intensive care unit all felt that way, and it's only when they've been faced with hazard, death, is when you realize, oh, it could be me. And for the parents that are involved, it again is, I can't believe this could come to this. I think we have to treat this as a very serious issue, and it's just not something you kind of roll off and go, oh, it's okay, they're vaping, it's safer. It's not. I think we need to be able to address it, knowing that this is going to have some long-term consequence. It's not without consequence. As a parent talking to as a child, you can only make them aware of what the potentials are, and hope to give them enough information they can make a sound judgment. So that's all we can do.
Okay. Thank you. I think finally I was just going to ask a little bit about any current regulations. Did you want to touch on that, or is there something else you want to touch on?
I think regulations are important. I think there's definitely complexity to this issue. The types of delivery systems that are out there, as we tend to legislate, sometimes there's this tendency to just do a broad brush. But there needs to be specific laws to address how we protect youth from this. I think e-cigarettes, for example, that are marketed towards flavors, which has been the target of many attempts at legislations, both in Michigan and now in New York, essentially going after the flavored cigarette market. This is, again, trying to prevent it from being marketed to a younger group as a recreational choice. And I think that is where we stand. Most of the medical organizations would stand against this. I think that they stand in the league of cigarettes, that we don't want this used. But at the same time, I think we have to have responsible legislation that protects young people. from access to these. I think there's Pennsylvania legislation currently that's making it illegal to vape in schools, which to me seems like common sense legislation. But then you have issues also of medicinal products in the state too. How we can regulate that people have medicinal needs for vape-related products that don't inhibit their ability to get access to medicines that they may need. So it has to be some nuanced laws, but it's also laws that we can't wait 10 years for either. I look at this from as a pulmonologist, I look at it from as a parent that we just need smart legislation to be put in place earlier to really protect young people from being too able to access these products and do it freely. I think we also should have significant punishment for those that put out black market products that endanger those that, like anything else, is profit over human life. So for those that put out black market materials, those who sell it, I think fines and laws should catch up for punishment. That if you're selling that in a school ground, or if you're selling it to a minor, or you're selling it period, there should be substantial hazard for those that do that.
Great. Are there any other topics you want to touch with that?
Those are the biggest. I think as we go into this, I think it's a role of everyone in the community to recognize we're veering away from where we should be with this issue. It's come up too quickly. Some health problems happen over years, whether it be the smoking issue, decades-long change, but we've seen just an exponential change in this, in part due to the technology. You know, we didn't have systems like this that allowed you to take a vaporized system in 1985.
Right.
But with the advent of technology, with the advent of batteries and the ability to mass produce these items quickly in a marketplace and get it out through an internet has made this of an epidemic proportion quickly. And legislation and societal change hasn't caught up with it. So it's going way too fast for us to recognize, and now it's a problem. So we have to be as adept to deal with the problem now and not wait for 5 years to figure it out. So it requires leadership on every level, local, state, and federal, to make sure that people are safe.
Okay. Thank you so much.
You're welcome.
I really appreciate you coming out and talking about this topic. You can also hear more about Dr. Piatt's presentation on Radnor Township YouTube from the Board of Health meeting that was September 16th. Thank you again for joining us.